Good morning, everyone. My name is Doris Rodriguez, and we'll get started in just a few minutes while we give people a moment to get situated. So if you need to get anything, please do so now. We'll start in a couple of minutes. I also want to announce that this presentation is available with AI-generated automatic closed captioning. Additionally, we are providing simultaneous interpretation in Spanish this morning, for which I will now provide instructions for our Spanish Zoom attendees to join. Hoy siempre brindamos servicios de interpretación simultánea para nuestros eventos, igual en persona o en Zoom. Favor de hacer clic en el globo al fondo de su pantalla donde dice interpretación, luego haga clic en el idioma que desea escuchar, en este caso español. Si quiere escuchar solo al intérprete, puede también hacer clic en el Mute Original Audio, que silenciará el audio original. Muchísimas gracias y de nuevo bienvenidos a Sinergia. Estamos agradecidos de tenerlos aquí. So I'm just going to start the Facebook Live. Just give me 1 second. Mhm. Alrighty. So as I mentioned, so before I begin, I want to let you know that we're broadcasting today's event live via our Facebook page. So I want to give a warm welcome to those joining us there. So a few housekeeping notes. Everyone who registered via Zoom will receive a copy of the presentation slide via a follow-up email within the next few days. A survey will also be shared in the chat at the end of the presentation. We will have time at the end of the presentation for Q&A. However, we encourage questions at any time. And please remember, this is a public forum and we are being broadcasted on Facebook. Once again, my name is Doris Rodriguez, and I am the Autism Initiative Coordinator here at Sinergia's Metropolitan Parent Center. A few words about Sinergia's Autism Initiative. The Autism Initiative project is funded by a grant from the New York City Council under its Autism Initiative. This project supplements the work of Sinergia's Metropolitan Parent Center by bringing an increased awareness to New York City residents, particularly to the communities with large Spanish-speaking populations, about the growing number of children diagnosed with autism. So, its strong outreach components target families of children with suspected or known diagnosis of autism who are not receiving appropriate educational, health, and other related services. This initiative will link them to other services and supports that meet the individual needs and their children. I want to thank you all for joining us. We're glad that you chose to be here with us today. So before we get into it, I would like to introduce our presenters for today. I want to welcome Nicole Peña-Martinez and Yasmin Jones from the Clinical Mental Health Services in the Bronx community at Fordham. So glad you can join us today. So I'll hand it over to you guys. Thank you.
Hi, everyone. Thank you for being here today. I'm going to go ahead and share my screen, but my name is Nicole, as Doris mentioned, and I'm here with my colleague Yasmin, and today we will be doing a presentation on identifying mental health needs in youth. And so please let me know if you're not able to see my screen.
Looks good.
Awesome. Okay, can you still see the screen?
Yes.
Okay, awesome. So, hi everyone. Thank you to our community partner Sinergia for having us here today to speak on behalf of mental health needs and rising community needs. And again, thank you to our attendees today for joining us for a remote session. Today's presentation is going to essentially highlight how emotions and behaviors may present across different youth populations, including those with autism. And so today we're going to be using a very parent-focused approach where we will explore common emotional experiences and offer practical strategies to support youth and families in gaining awareness around emotional expression and also coping skills. And so hopefully the goal today is to help participants gain some insight into better understand and identify youth mental health needs. So just for some context, we will be doing some check-ins throughout the presentation and we will have some resources at the end as well. So feel free to pop in any questions in the chat at any time and we can address those a little bit later on in the presentation.
Okay, well, a little bit about us. As Doris and Nicole said, my name is Yasmin. I am a mental health counseling master's student. I'm graduating very soon, and I do mental health counseling with youth and adolescents and families. My focus is on helping marginalized populations. I really like to help people, like the community where I came from, and just focus on their wellness and family success.
And again, my name is Nicole Martinez. I am a student at Fordham currently. I'm in the counseling psychology PhD program. It's my first year there. And through CCMH, I am an admin assistant, and I also do some workshop coordination. So we'll get started with the presentation now. Okay, so here we have our listed counseling services. Essentially, the CCMH program is a virtual mental health program run by the Graduate School of Education at Fordham University. It's based remotely and essentially aims specifically to provide free telehealth mental health services for Black, Latinx, and immigrant children and youth in the Bronx. And essentially, this is really important to do because these groups often have divergent and complicated needs. And so CCMH was created essentially to help support the services that the families need. And we've offered free virtual, individual, and group counseling, as well as workshops, all geared to support thriving in school, healthy relationships with peers, and coping strategies within families. All services and materials are offered in English and in Spanish in order to accommodate the needs of very diverse families. And we also wanted to mention that CCMH was created in March of 2021, and we will be officially closing at the end of June. And so we just wanted to say thank you for this opportunity to provide another workshop. We are very thankful to have been part of the community initiatives geared to supporting mental health and within the Bronx specifically. And we're very thankful to have been able to serve so many families and students throughout the 5-year run that the organization held. Okay, so here we have today's agenda. We're going to discuss a few different things. So first, we'll start off with an introduction to mental health, and we will explore some definitions. Second, we are going to discuss mental health disorders and signs and symptoms, ways to support youth and family members, parent challenges and strategies, and we will end the presentation by going over local resources.
Okay, perfect. So we are going to be doing a lot of talking to you today, but we wanted to make sure that we included some interactive activities so that we can learn a little bit more about who is here and we can kind of gauge what things that you need in this workshop today. So if you would like, you could share in the chat. I don't know if you have the ability to come off mute, but we'll definitely take your answers in the chat. And we'd like to know what brings you here today, and or what do you hope to learn from this workshop? So Nicole gave us a great brief of what we'll be talking about, but it would be lovely to hear exactly why you came, and we can see if we can add a little bit of that in as we go along. I'll wait a little bit, so we'll have a little pause um, to see if we get any answers. And if not, we can move on, but I want to give you a chance. Okay. Well, if you are still writing, oh, perfect. I'm here to find a good therapist for my child as well as I. That is a great initiative. And we have some resources at the end that can point you in the direction of where to find one. And we can also answer more specific questions if you have something specific that you're looking for. And then we also have to learn experiences for special needs children of ours. And that is going to be the whole focus of today. So hopefully we are able to address your needs and concerns. And if we're not, we can answer your questions at the end. More than happy to. We can go to the next slide. Okay, perfect. So in Grounding ourselves, well, when we're talking about identifying mental health needs in youth, it's important to ground ourselves in what mental health even is. So, mental health includes the emotional, psychological, and social aspects of a person's health. So, when we're talking about the emotional aspects, that's how a person is feeling, whether they're having lots of moments of happiness or anxiety or sadness or anger. That is all encompassing their emotional mental health. Then we have their psychological mental health, and that's really what they're thinking. So if they're having lots of worries, or if they're having lots of positive talk, those are different aspects of your psychological health. Then we have the social aspects, which is how you're functioning interpersonally. And so, is your child making friends at school? Are they getting into conflicts with maybe teachers or other students? How are they even functioning within the family? And so, a lot of times we talk about mental health very broadly, and it can be hard to think of those specific markers that show whether we're doing okay. Today, we want to focus on the fact that mental health is not, or positive mental health is not just the absence of mental health disorders or the absence of a crisis moment. That's what we kind of always think of when we think of mental health, is like when things get as bad as they can possibly get, or when you have the most challenges. But really, positive health is just being able to in a healthy way, deal with the stressors of life, realize your full capacity and do your best in your different tasks, and then work collaboratively, productively. This might be at school, this might be at work, and then contributing to your communities. So, are you able to accurately or in the best way care for your family? Are you able to contribute to your friend group? These are all things that make up your mental health. And as we go through this presentation today, we're going to show you how to recognize signs in these specific areas that maybe you might need some support or you're going through a challenge. And so hopefully that can give you some more clarity about all of the different things that are included within your mental health. Um,
Okay, so now we will get into why mental health in youth matters. Like Yasmin mentioned, mental health is more than the absence of mental disorders. It is important to prioritize your mental health as it impacts your overall physical and well-being. And essentially, mental health matters for youth and also for every individual across the lifespan. Early prevention and intervention can halt or slow the progression of mental health disorders before they reach a crisis point, kind of alluding to what Yasmin was saying earlier. And essentially, we really wanted to highlight that according to different sources, half of all lifetime mental illnesses begin by the age of 14 years old. So it's really important to have that timely support for long-term health. And so here we have a few different things listed in terms of why mental health in youth matters. Essentially, as I said, early experiences kind of shape long-term well-being, mental and physical as well. And there are a lot of increasing rates of anxiety, depression, and stress among teens and youth. And so there is a really important emphasis on early identification and needed supports. Okay, so here we have a few different mental health conditions. Again, this is a little bit more of an introduction, so if you have any questions, please feel free to add them into the chat and we can get through them a little bit later in the presentation. So essentially, throughout our lives, there are many different factors that can impact our mental health. These include psychological and biological factors such as emotional capacity and skills, substance use, and genetics. And overall, these can kind of make people more vulnerable to different mental health problems. Exposure to different social, economic, geopolitical, and environmental circumstances, including things like poverty, violence, inequity, and environmental deprivations, also increase people's risk of experiencing mental health conditions. And so we wanted to highlight that, of course. There's a lot of different intersecting factors here that can kind of impact somebody's mental health and the conditions that they experience. And so to the left of the slide here, we have a few different mental health disorders listed, such as anxiety disorders, mood disorders, psychotic disorders, neurodevelopmental disorders, eating disorders, substance use disorders, and personality disorders. And to the right of the slide, we have different psychosocial disabilities and mental states associated with these, highlighting significant distress, an impairment in functioning, and a risk of self-harm.
So on this slide, we're going to talk a little bit about the signs and symptoms that you can watch for that might allude to either you or your child going through some type of challenge and maybe needing some more support. First, we have feeling sad, worried, scared, or hopeless. And so with a lot of these signs and symptoms, I do want to say that a lot of these are normal parts of life. They're part of the human experience. What is cause for concern is if this is the majority of the time, or you see this during the majority of the time. And so if you used to have a child or a student or you yourself who used to feel a wide variety of things, happiness, joy, nerves, but it was kind of all floating in the middle, and then all of a sudden you have someone, or over time, you have someone who is always feeling sad or always feeling worried and hopeless, that's something that you can be concerned about. The next three tie in together very well. We have experiencing extreme mood swings, being irritable or angry, and having angry outbursts. And so again, especially if we're dealing with teenagers and adolescents, all three of these things are a part of that developmental phase. But if you have something that's happening all of the time, that might signal that something is wrong. So going from being calm to extremely angry or extremely sad and crying, being very irritable and angry all of the time. Sometimes people don't realize that irritability is a way that people sometimes express or manifest their depression or their anxiety. And especially in marginalized groups, specifically women of color, irritability is one of the main ways that depression shows up. So it's important not to just see it as a little bit of crankiness, but to see it as a sign that they might actually need some more support. Having difficulty coping with everyday stressors is also important. Excuse me. If there's an inability to deal with things that normally wouldn't make them very upset, or things that they should developmentally be able to handle, that might be something that is a cause for concern. Of course, changes in academic performance. And these changes can be for so many different reasons. Sometimes our mental health affects how well we're able to focus in class. And so their ability to retain information and do well and function productively in the classroom is affected by their mood, is impacted by their cognition, and that can let us know that they might have something going on that we need to watch out for. It also can be a sign that there's some other need that they need addressed, like maybe they're tired, they're hungry. There's different things that can impact a student's ability to focus in school, and all of those things will impact their academic performance. The next one, signs of drug, alcohol, and substance use. That can be a sign of many things, avoiding emotions, or maybe it's just a sign of the social group that they're in. And either way, that's something that is cause for you to be concerned and to watch out for. And of course, signs of self-harm would let us know that they're feeling something that's manifesting in that way. On the right side, we have withdrawing from friends, family, or community. And that alludes to that social aspect of mental health I mentioned before. Even if a person is functioning well, if they're isolating themselves in their room all the time, or if they don't really want to talk to anybody, that is a sign that something may be going on with them emotionally. And that is aligned with canceling plans with friends and having difficulty relating to others, especially when we talk to autism, their interpersonal skills and their interactions with others can definitely show us a picture of what's happening internally. And it might show us that there's some differences that are not bad, but that it would be important for us to know. Lastly, we have some physical signs. So having trouble sleeping or not getting enough sleep. either eating all of the time or having no appetite. Any changes within the sleep or eating patterns can be a sign of many different mental health disorders, or just the things that come before that disorder happens. And then unexplained physical ailments like headaches or stomach aches. These are called somatic symptoms. And a lot of times, again, in marginalized groups, they might not complain about being depressed, or they might not say specifically that they have anxiety or that they're having thoughts that are causing them any worry, but they might complain about a headache all the time or a stomach ache because this is how they're experiencing the pain that they're feeling. So this is not all encompassing, but these are some really important and helpful signs that you can look out for. That doesn't mean that there's a fire, but that might mean maybe there's some concern that you could have, or maybe there's something that you can do in a preventative nature that can help everyone be more functioning and successful. This next slide is about the difference between maybe a mood or a behavior concern versus a disorder, which is kind of what I alluded to at the beginning of the last slide. A lot of these things are natural parts of life, but really it's the severity that determines what steps you need to take and how concerned you need to be. So in the example of depression, the difference between a depressed mood and a depressive disorder that would have a diagnosis or maybe some more extensive treatment would be the time period. Were they feeling depressed and sad for less than 2 weeks? Or are these periods of several weeks, maybe months, where they're feeling this overwhelming sadness? For a depressed mood, the cause might be a specific event, and that's completely natural. So if someone is grieving, if there's a loss or disappointment, if there's anything that would naturally cause sadness that happens, we wouldn't jump to say they have a depressive disorder because they're responding adaptively to what's happening in their life, and they just need time to process that emotion. On the other hand, a depressive disorder might look like someone who is feeling overwhelming sadness and they don't know the cause, and it doesn't look like anything that would cause sadness has happened to them. Of course, we don't know everything that's going on in people's minds, so it's always helpful to ask questions and to have those conversations, but that would be the difference between the two. Um, some other changes in mood changes throughout the day. Maybe if they're just having a depressed mood, there's not really a pattern. But if they're having a depressive disorder, it might be a lot worse in the morning and then improve in the evening. Some examples in behavior and daily functions that you can see what that really looks like. Someone who's just experiencing a depressed mood, they might say they don't want to study or complain about doing homework, but they might end up doing it eventually. They're still able to function. Whereas someone with a depressive disorder that's more severe, because of course there's different levels for all of these things. It's not completely black and white, but a more severe case would be not wanting to do anything, not being able to do anything, not getting out of bed, not doing any of the activities that used to cause them joy. That would be the difference between the two. And then with thoughts of suicide, which are always something to be concerned about, someone with a depressed mood might just be exploring those thoughts and want to have a meaningful conversation with you about that. Whereas someone with a depressive disorder might find those thoughts really hard to control. They're thinking about that all the time with more seriousness and with more motivation. And both of those things are areas of concern, but the way that they're thinking about it can really help to paint a picture of what state that they're in. So I'd like to say that all of this happens on a scale, and you might have someone who does have a depressive disorder who is able to go to school and wake up in the morning and do all of their tasks. It really just depends on the specific person, but this is just a general overview to give you an example of what the different manifestations of this mood can look like.
So, something we definitely want to highlight in addition to mental health is how important context can be. And the reason why this is so important is because, in order for people to get effective treatment and support, culture plays a very big role in that process. And so, part of this presentation, we want to acknowledge that cultural views impact different views on mental health in terms of the values that are ingrained in that specific culture. And so, essentially, in other words, culture does shape how individuals perceive, experience, and express their mental health. Similarly to what Yasmin was saying, when some people might experience more somatic symptoms versus other symptoms. And so, it's important to have that understanding that everybody comes from a different background, and that does impact their views and behaviors when it comes to mental health and support. And so, essentially, there are different levels to this, including symptom description, stigma levels, and help-seeking behaviors when we navigate this kind of conversation. So, cultural background does determine whether mental distress is seen as a medical issue, sometimes more of a spiritual matter, or essentially a personal failure, with some cultures prioritizing physical symptoms over psychological ones, like I alluded to. And so, again, it's really important for clinical services to be inclusive and culturally responsive so that families feel supported and seen. And the reason why we wanted to have this slide as part of the conversation is because it's really important to understand how effective tailored services can be for different diverse families, and understanding barriers to effective help or clinical help could be the first step in building the trust necessary to receive effective services and supports. Okay, so we wanted to check in. If you have any questions at this point, please feel free to leave them in the chat. But I'm wondering how it's going. If anyone has any comments or anything, we definitely want to hear what your guys' opinions are. So feel free to leave anything in the chat, and I'll go ahead and check that for a minute or so.
Mm.
Okay, we'll go ahead and move on then.
Okay, and thank you, Rahima. Okay, so next we're going to talk about some of the emotional aspects of mental health in youth. Core emotions in youth, but really for everyone, include happiness, sadness, fear, anger, surprise, and disgust. It reminds me a little bit of the Inside Out movie, if you've ever seen it. That is a really kind of clear picture of the core emotions that drive us. Expand it a bit, and especially when we're feeling like we're going through a challenge or we might be approaching crisis, we're feeling frustration, anxiety, shame, guilt, loneliness, and overwhelm. And so these can look like different things, and it depends really on your culture, your personality, especially the developmental period that the youth is going through. A young toddler is going to express anxiety different than someone in elementary school, and then definitely again different than somebody who is an adolescent in high school. And so they might change as they grow up. And that's why talking to them becomes even more important, because what might look like anger, and we'll talk about this a little bit on the next slide, might actually be something else. And one of the most effective ways of figuring out what's going on is just providing an environment that is free of judgment, that feels safe, so that they can express these emotions to you and you can help them cope with them in a healthy and developmentally appropriate way. And so, as I just alluded to, anger is often a secondary emotion. And what that means is that sometimes when people feel when people feel things like anxiety or sadness, particularly, they might feel more comfortable, or it might be more natural for them to express that emotion as anger. It might mask deeper feelings that are happening. And it definitely can lead to misinterpretation and misunderstandings. And you can kind of picture how that could happen for a student, a child, where it seems like they're always angry, they're not happy with you, and they're always kind of lashing out. It can cause some feelings and emotions within us, which is natural. And so it's helpful to remember that even though it seems like they're lashing out at us and that they're very angry, it might be because they're very sad or because they're really worried about something and they don't know how to express that sadness or that anxiety in any way but through angry behavior. And this is something that is seen more often in boys and men than girls, just because our society kind of conditions men to think that anger is a more appropriate emotion to display. And that might apply for anyone. People might not want to seem or be associated with the weakness that might come with looking sad or looking anxious. And so anger is kind of a go-to emotion in our world, but it really is a signal for so many other things that could be happening. So that's important to consider, especially when we're dealing with youth who might not even have the skills yet to express their sadness or anxiety. And anger is the only way they have of expressing themselves.
Okay, so now we're going to be talking a little bit more about behavior as a primary way of communicating someone's internal experience. And so behavior can tell you a lot about a person. It indicates how individuals respond to internal and external stimuli, revealing their motivations and internal emotional states. And so here we have listed a few behaviors and the potential emotional experiences underlying them. And so, as Yasmin had just mentioned, aggression or anger, that could be a behavior that a youth or an individual experiences or exhibits. And their internal kind of monologue and emotional experience could be that they are experiencing feelings of being scared or overwhelmed. And so we have a few others listed here, one of them being withdrawal. This could look like potential sadness, anxiety, or frustration that someone may be experiencing and not communicating outwardly. Avoidance could be an internal experience of anxiety and or shame. And then lastly, here on the slide is perfectionism. And so a possible emotional experience for someone exhibiting perfectionism is a fear of failure. And so it's important to kind of increase your understanding of what this behavior could look like and what a child or a person is trying to communicate to you. Okay, so here we have a few barriers to emotional expression. It can be difficult to express emotions for different people for very differing reasons. Here we have essentially one of them being limited emotional vocabulary, a fear of consequences, cultural expectations, and or neurodevelopmental differences. And so it is important to teach youth and people overall what emotions are, how to identify and label them, and essentially how to experience them and express them in a healthy way. And so from there, the next part of the process would be working towards emotional regulation. And this can be taught so that the individual feels supported by others and they have an increase in their ability to cope with stressors in life and distressing situations overall.
Okay, this slide is a little bit about autism specifically and the emotional experience that people with autism spectrum disorder may have. And so some things that we notice often are differences in processing. And processing can be different things. That can be like verbal processing, where the same cues that another person might register, especially as an emotion, maybe they have some differences or challenges with processing that visual information. There could be auditory processing differences, where maybe it takes more directions or more specific directions for them to get a task done. Sometimes we like to give like two-step tasks, like go to your room and put your books away. But those can be really difficult for people who have auditory processing challenges because one direction at a time would be more appropriate for them to understand and process in a timely manner. Differences in processing can look like delays in responding, maybe conversations that take a little bit longer than you would expect with someone else. And so processing just kind of means how well they're able to absorb the information that is being given to them and then respond in an appropriate way. And there might be some differences in that. Difficulty labeling emotions. As I mentioned before, sometimes people with autism spectrum disorder have some challenges in interpreting the emotions of others, whether that's reading body language, reading your facial cues, or even reading the more subtle nuances in conversation, like idioms or sarcasm, things like that. That can be a little bit difficult depending on the specific expression of the person's autism. So that's nice to keep in mind. Sensory sensitivities, which can include many things. Sometimes people with autism spectrum disorder have a sensitivity to sound. And so too many sounds or too sounds at a too high of a volume might really be overwhelming for them. It can also be textural, like certain things on their skin make them really uncomfortable. There can be lots of different ways that their nervous system is processing the stimuli in the world, and they might be sensitive to that in a way that is different than you might observe in your other children. And then lastly, unexpected patterns of expression. So a lot of times people with autism spectrum disorder have repeated behavior or things that they do physically or verbally that help to calm them down. And it might be unexpected. It might seem out of the ordinary, but this is a way that they express themselves, a way that they regulate their own bodies. And so it might be unexpected, but it doesn't necessarily mean that something bad is happening or that you should be concerned. Mm. And then next, some more behavioral patterns in autism, meltdowns or a loss of control. I talked a little bit about that sensitivity in the last slide. And sometimes if there's too much going on and there's too much overwhelm, it can lead to a meltdown, which looks like they've kind of lost control. And it really is that they're overwhelmed. There's too many things kind of setting off alarms in their mind. And it's helpful to bring them to a calm moment, a calm place, so that they can regulate their nervous system again. Shutdowns and withdrawals can be for the same reason. When people are feeling overwhelmed, it's safe to shut down and give your body a break from experiencing those things. And so they might need more moments of withdrawing away, maybe from an activity or maybe a social interaction, so that they can again get back to a moment of regulation and then proceed again with these activities, which can present some challenges and can be overwhelming. Lastly, repetitive behaviors, as I said before, are a way of coping. And so I think sometimes people call it like stimming, some people they call it different things. But these repetitive behaviors and interests are ways that they express themselves, ways that they cope and regulate their emotions. And these are just some behavioral patterns that you might notice.
I'm going to check the chat because I noticed a few messages coming in.
Yes. One
Okay.
question was, is it normal to experience mood swings and emotional fluctuations? And I just wrote that to an extent, yes, especially if we're dealing with, people who are going through puberty. But it depends on the duration and the severity. And then it also depends on if it's impacting their functioning. Are they
Mhm.
experiencing mood swings that make it so that they can't go eat dinner or they can't go to school, they can't do things that they need to do in their lives? Then that would be a sign that they might need some extra support. So it really depends on specifically what you are observing.
Yeah. Thank you, Yasmin, for responding and for keeping up with the chat. I'm seeing another question here. I think it's a little bit of a longer question, so we can add that to the discussion towards the end, just so that we're able to continue with the slides. But feel free to send a response if you like. But thank you for asking questions. We'll make sure to get to them. Okay, so now discussing the why of a behavior. Essentially, there are a lot of different reasons behind the why of a behavior. Here we have listed a few different ones. So someone may be feeling overwhelmed or overstimulated. There may be communication challenges or barriers to expression. And similarly to feelings of overwhelm, someone could be feeling distressed from a trigger in their environment. So this could look like anything that causes somebody extreme discomfort or activation in their body. And in other words, an environmental trigger could be an external factor or a situation in your surroundings that causes a specific physical, emotional, or behavioral reaction. And these triggers can initiate health symptoms, they could spark emotional responses, or provoke behavioral changes. So here we have the why listed as sensory overload, or feeling overstimulated, having communication challenges, feeling emotionally distressed, and again, those environmental triggers. Okay, so now we're going to go into parent challenges. This isn't an exhaustive list, but some of the things that we included essentially consist of interpreting needs, managing unpredictability, navigating supports, supporting independence for youth, and environment. And supporting youth can be challenging for parents over the course of many different time periods. And so we're here to next go into how to address these challenges.
So, some parent strategies that you could use to address the challenges we spoke of, modeling emotional language is super helpful. And especially with young ones, it might even be helpful to practice, like displaying that emotional language and recognizing it in others. So, things like visual emotion charts that show what a person who's happy looks like, what a person who's angry looks like. That might be helpful in bridging that gap and being able to interpret emotions, and then also showing like when we're happy, we do this. And when people are, sad, we might do this, and giving that example for them. Using visual tools like the chart that I just mentioned, or even like the one on the screen, can really help make things more clear, especially considering those processing differences that we talked about earlier. And so a visual like this might help a child recognize at a certain time we brush our teeth, we wash our hair in the shower, or we go to bed. And the order might really help someone to adjust and process what they're supposed to do or what you would like them to do. Validate before redirecting. This is something that I thought of when I read the question in the chat of like if a teen is kind of like happy in their own space or doing anything so that we can make this more general. It's important to validate what they're doing before you redirect them. And validating means letting them know that you see what they're doing and that you're supporting or valid, it's hard not to use the same word, but that you're trying to understand the emotion that they're feeling. So in a moment like that, it could be like, wow, I see you're feeling really happy. You're enjoying spinning around. That's great that you're having a happy feeling. And then you redirect and say, now we're getting ready to have dinner, or now we're in a room with our friends and family. Wouldn't it be nice for us to like spend time with them and have conversation with them? So instead of just focusing on what you want them to do, it's important to validate their own experience first as kind of like a bridge to take them from what they're doing into the next task. Building routines is super helpful because children who don't have autism benefit from this, adults benefit from this, but even more so people with neurodevelopmental differences and challenges. Routines can help them know what to expect and know what to predict from their environment, and that helps them to be less overwhelmed. If they know that a certain time they go to school every day and it's not a surprise, they can mentally prepare themselves for that, and then it won't be as drastic as a transition moving on to the next thing. And then leaning on supports. The support might be from your family, your close friends, different programs and resources that you can find. I know a few of you guys mentioned in the chat looking for therapists. There's lots of resources and supports that are available for children. Some people have more accessibility to them than others, but it's important to find the supports that work for you and work for your family because it's not something that can be done. Well, it can be done in isolation, but it's much easier if you're leaning on support from resources or the people in your life. Next, we have some ways to teach emotional awareness. And this is an example of one of those visual charts that I mentioned earlier. They might have color-coded symptoms, and it's nice to practice this emotional awareness during calm moments so that they can access that information when they're feeling more escalated. So if you talk about what sadness looks like and what anger looks like when they're feeling calm, then that information can be processed and they'll have it ready when they are in a moment of crisis and they might know what to do. So this is just an example on the right of what that could look like.
Okay, so next we're going to be talking about how to respond to distress and dysregulation in youth, and this also applies to different populations as well. So essentially, just to provide you with some more information, dysregulation refers to the inability to manage emotions, behaviors, or physiological responses in a healthy and adaptive way. And this often leads to reactions that are excessive, unpredictable, or out of proportion to the situation. So it doesn't match the situation necessarily. And it often manifests as intense emotional outbursts, rapid mood swings, or in the case of the nervous system, this could be feelings of being stuck in a chronic state of fight or flight. And so it's really important to master environmental triggers. This does take time, however, and so it's also important to kind of explore your child's needs, their language, and their behaviors collaboratively. And here we have a few different steps towards responding to stress and dysregulation, including reducing any stimulation or things that might be contributing to the distress that the child is experiencing, avoiding punishment, and also co-regulating. And so this process can take time as you examine what distress and dysregulation can look like, since this does differ between every person. But essentially, it is really important to learn the language of your child so that you're able to kind of assist them in this process, de-escalate the situation, and lastly, co-regulate. So essentially, you're kind of showing them how to regulate. You can model some deep breathing, having safe body and other developmentally appropriate coping skills. Okay, so as I mentioned, building skills does take time. It is a process that looks very different for every single family system and child. And so here we have a timeline and process kind of describing what it looks like to increase regulation with the child. And so first, the first step would be building awareness. And this can be for anyone in the family or any social support, is building that awareness, kind of learning what the language is of the child, and what is going to happen next. Labeling the experience. So this includes labeling the emotion, the potential trigger in the environment, and what behavior that leads to. And lastly, working towards regulation. So learning how to calm down and return to a more comfortable baseline.
Something else important to consider is focusing on their strengths. Sometimes when we're experiencing challenges, it can be easy to focus on the deficits or things that are going wrong. But all children, especially children with neurodevelopmental challenges, or differences, they have strengths and unique skills and knowledge that they can bring into your family, into the home, into the classroom. And it's important to focus on those strengths as well. Using these can help support your youth in their lives and in their adaptation to whatever is happening in the world. Oftentimes they do have skills and strengths that you can leverage to help them be more successful. And then this slide, I think, is super important. It's about collaborative care and intervention planning, especially when we're talking about school. When you have any child, but especially a child with autism or any other neurodevelopmental disorder, it's important to be very collaborative with all of the other vested adults in their life who are providing care. And so when we talk about the schools, they're responsible for identifying students that may be at risk. And so that's why it's nice to always have a good method of communication with your child's teacher or with the administrators at your child's school. Keeping close contact with your child's teachers or mental health care providers. It helps you to receive more support from all of these different helping professionals who can determine what needs and services would best support your child. So there's psychologists who work within schools, social workers, and counselors, and these are all people that you can partner with. You can come to them if you have any concerns, and they can either do the assessments or guide you to the place to get assessments done that can help determine what needs that your child has. If you have any referrals, as I said, you can always contact a parent advocate if they have those at the school, or reach out directly to the mental health professional so that you can express your concern. And then there are different interventions that can be delivered based off of what your child needs. And it says that some are more effective than clinical treatment alone, and that's true. And that's why we need to rely on all of the different partners that we have in community. Sometimes this can be difficult, and I think we're going to talk more about school-specific interventions on the next slide. But this can be difficult because people who work at schools are busy. There's lots of children who need support. And so sometimes it's really easy for students to fall through the cracks. And as a parent, you are, or a caregiver, you are your child's like biggest advocate. And so you have to make sure that even though the teacher is busy, that they know, hey, my student or my child needs this, and it's their legal right to get the needs that they, or to get the services that they need in order to succeed academically and socially at school. So sometimes that's easy and sometimes it's not, but it's definitely necessary to have that level of collaboration.
Yes, and building on what Yasmin just shared, it is really important to have that collaboration within the school and outside of the school. And it's also really important to ask these questions because some of this sort of process isn't necessarily explained. And so asking questions is really important so that your child can get that support through school and outside of it. So while support can look very differently based on a family's needs, we have listed here a few different interventions and supports within the school system. This essentially includes different types of programs like early intervention for infants and toddlers, so for younger kids, special education plans looking specifically at IEPs or 504 plans. There's also psychoeducational evaluations at some schools that are offered. There are school or community-based mental health counseling services that are really important to kind of look into on a local level. There's also different external support services like family therapy or individual therapy. There are transitional services from childhood to adulthood and different programs that kind of revolve around that sort of curriculum. Additionally, there's vocational programs, day programs at different treatment facilities. Case management resources are also really great, and housing and residential options for youth that might need those kinds of services. And so, again, it is important to seek out tailored support services based on what you, your child, and your family might need. And at the end of the day, kind of consider what services might be best suited for you and your needs. And in a few slides at the end of the presentation, we have a few resources listed for you to review. So we can kind of go into that in a little bit more detail. And if you have any questions regarding the resources that are listed, we can also answer some of those. Okay, so here we have some tips for parents. Again, this is not an exhaustive list, but essentially some of the ones that we had included here include asking for help and learning more about your child's mental health, connecting with other parents of children with mental health needs and creating that community inside and outside of school. Being patient, so learning may come slower or be impacted for your child, and so having patience along that process. Also encouraging independence and responsibility whenever safe and possible. And this truly does come in when you advocate across different types of levels for your child, educating yourself on the educational services your child deserves. And so asking those really important questions at school and outside of school, learning the laws written to help your child live their best life, and looking for opportunities in your schools and communities for support. And while this isn't listed on here, I thought it was really important to kind of mention that essentially, as a parent, you always have to remember to be kind to yourself as you navigate this process. This can be a really intense process, and self-care and social support is really important to kind of lean into.
Okay, as we wrap up the presentation, we're going to go over some resources that you might find helpful now or maybe in the future. The first slide has some resources for if you are in crisis or if a loved one is in crisis. There's NYC Well, which is a 24-hour mental health hotline. There is Crisis Text Line, which is also a 24-hour line that you can text, a suicide prevention lifeline, and then New York Project Hope Emotional Support Helpline. So these are all numbers that you can call or text if someone is going through a moment of crisis and they need some more support. And the people on the line will help guide you to further resources if necessary, and help you to get the help that you need. Of course, if there's ever a crisis and you need to go to the emergency room or you suspect that someone may need more intensive and emergency care, 911 is also primed to handle mental health crises. And so that's another number that you can call to get some support.
I also wanted to mention that we will be sending these specific resources in a separate document to Doris, who will share that with you as well. So feel free to take a picture or a screenshot, and we also will be sending this material to you as well.
Yes. Okay, and then this is a slide with some resources that are for when you're not in crisis. Because when you are in a moment, maybe someone's having suicidal ideation, that's not really the time to reach out to a therapist. But when you're in a moment of non-crisis, you can look for some more preventative services and things that can help you so that you don't approach moments of crisis as often. So of course, at the top, the school psychologist and counselor, especially for students, is like the number one go-to. There should be at least one at every school, and their job is to help with the mental health concerns and needs of the students who are in the building. Then there's community services, like the New York Center for Children and the New York Foundling. They have lots of different programs for youth and for families to receive therapy and receive support. For adults and parents, there's resources like Headspace and Calvary Hospital. And then if you're looking for a private practice therapist, if you have like insurance or if you're wanting to pay for your therapy sessions, you can look on Psychology Today, ZocDoc, or even Therapy for Black Girls. Those are three examples where you can scroll through different clinicians and therapists and counselors, and you can pick someone whose specialty is fits your needs, and who seems like they would be a good fit for helping you along your journey. There are more resources as well. So this list is not exhaustive, and with time, it's becoming a bit easier to be able to find a mental health counselor. But it can be difficult. And so what I also like to tell people is that the first counselor you get might not be the best fit for you, and that's okay. Part of accessing mental health care is also the process of finding the right counselor for you. And that might take some time. It definitely takes some emotional effort, but it can be worth it in the end once you do find someone who is able to support you and the needs of you and your loved ones or family.
Okay, and so here we have a list of several New York City mental health services for non-crisis situations and specifically for youth with autism or with ASD. And so specifically here we have listed three different resources. And while we were looking into resources and services that we felt were the most appropriate given the presentation topic and the community members attending, we felt that it was really important to include this part specifically. And when looking into this, we also looked into different services and whether they were offered in English and Spanish and what that looks like. So again, we'll send this information over to you, but listed here we have first the quality services for the autism community. Essentially here they offer different things like ABA therapy, social skills groups, family support, educational and vocational programming, transitional supports for different adolescents and young adults. And essentially, the last sentence in each of these includes whether they offer services in Spanish and other languages. And we have listed different addresses, the main website, and the phone number. And so the second one is the Child Mind Institute, specifically the Autism Center. And so here they have evaluations, again, social skills groups, which you'll see pretty commonly offered at different types of community clinics and hospitals, parent training, which I thought was really interesting and could be very helpful in understanding sort of the language and process surrounding this. They also offer different interpreter services, which I thought was really important. And again, the last one is hospital based. So the NYU Langone Child Study Center, here they also do diagnostic evaluations. They offer psychiatric care, so a little different level, and social skills groups, family counseling, transition to adulthood planning, and different workshops. And so we kind of wanted to include this again just to make it a little bit more prevalent to the population here. We also have some more resources. These are a bit more general and based here in New York. So we have the OPWDD. We have different community agencies listed here, like Catholic Charities and AHRC, the Adult Career and Continuing Education Services, and the American Association on Intellectual and Developmental Disabilities.
Cool. So to wrap this all up, some key takeaways. As we said in the very beginning, mental health is emotional, psychological, and social. It encompasses all of those things. And so it's important to look for markers in each of those domains when you're trying to evaluate the health of your child or yourself. Emotions go beyond anger. Sometimes anger is what we see in the behavior, but it doesn't always paint a complete picture of what's happening beyond the surface. Behavior communicates needs. And so children do things when they're trying to communicate something to you that they need something, whether it's more support or whether it's acknowledgement or validation of something that they're going through or feeling. The behavior may be very concerning or frustrating or challenging to deal with, but it's a signal that there's something going on deeper, and it's important to be able to engage with that in a way that is productive and supportive for the child. Autism spectrum disorder may affect emotional expression rather than the emotion itself. And so people with autism spectrum disorder still do feel emotions, anger, sadness, anxiety, and worry. And it's expressed in different ways, but that doesn't mean that the emotion is not there. And so, because it does look different than maybe in other people, that's important to remember that maybe I'm not seeing the signs of emotion that I'm normally used to, but that emotion is still there and it still needs to be addressed in the same way as a child who is openly expressing those things. Skills can often be built over time. And so, first, we have awareness of what's happening. Identifying emotions is super important, and it can be really helpful to walk children through that process. Then they can help label the things that they're going through, and then the steps towards regulation will come after that. So it is a process. It's not something that happens all at once. And as the people who are part of their support system, our role is to help guide them through that journey so that they can eventually regulate with maybe a little bit less support or even independently if that's within their capacity. And then lastly, parents have many resources available to them in crisis and non-crisis situations. So we just shared a few slides. There's more out there. You can contact your primary care provider, a counselor, different clinics, and there are lots of people who are more than happy to help find the resources that you need. That's our job as mental health professionals, and we always would love to get you more and more support so that you can function in a successful way. And that is our last slide. So we wanted to thank you so much for listening, and thank you for the questions and comments that were already shared in the chat. If you have any more questions, please feel free to put them in the chat, and we'll get to them as best as we can. And also, if you could take a moment to complete our feedback survey, that would be great. There's one in English and Spanish, and it just kind of lets us know if we appropriately addressed your concerns and the title and focus of today's workshop. But yes, this is the time to ask any questions that you have or make any comments that you have. We would really appreciate it. Hmm.
Jasmine, would it be okay for me to, I know that there was a longer question on the chat. I can paste it back on there if you want to answer that. And we also had three pre-registration questions. Sorry, let me come on camera. We also had three pre-registration questions. I don't know if you would like to address them as well.
Sure, of course.
Okay.
Um,
Should I stop sharing the screen? Is that okay?
Oh, sure. Yeah.
Okay.
Okay, so it says, what could it be best understood for teens and adolescents with special needs, having some fidgety moments, happy and moving about, and then essentially stopping these moments once being reminded to stay in the moment. And that's where the validation piece that I was talking about can be really helpful, because as we just said, behavior is a form of communication of a need that they have. And so maybe in that moment, the behaviors that seem fidgety or seem like they're moving around and jumping around, that is expressing a need that they have. They might need that extra stimulation in the moment, which is something that happens where people want more stimulation opposed to the opposite, where it can be overwhelming. And so it's nice to have a gentle transition where you validate what they're doing, validate maybe the need that it serves, take a moment to ground them and calm them down, maybe take some deep breaths, and then ask them to be more present in the moment. The first time you do that, it might be difficult, but as you practice and you keep being calm during that process, it can be a little bit easier for them to transition between moments. I don't know if Nicole, if you had anything else that you wanted to add to that question.
I think you did a really great job answering that, and you definitely provided like a very all-encompassing response. So I think we can move on to the next one. And then just to let everybody know, I am going to be dropping the survey links in the chat.
Okay, perfect. Um, the next one says, how can we assist with anxiety? Um, did you want to answer that one, Nicole?
Yeah, definitely. I think in addition to covering what we covered today, we could also do a separate workshop just on anxiety alone because there's so much to cover there and uncover there. We could also probably send over some resources related to anxiety if that would help. But essentially, something that we've really stressed throughout the presentation is understanding a person's context. And so what this looks like essentially is like what is the language in the family surrounding different kinds of things like anxiety? How does culture impact that? What supports are they receiving at the school level and outside of that? And so, kind of exploring where anxiety may arise for the youth and the child, and overall, like for somebody in general, is a really important starting point. And I think in addressing the anxiety and where that may be stemming from, that could kind of point you to the most appropriate action steps. And so, what I mean by that essentially is if somebody is experiencing anxiety based on something from school versus something within the home or within a specific relationship, that can kind of point you to the relevant intervention that they may need. But I think that overall, self-regulation is the key to understanding how to kind of support somebody in terms of anxiety and different symptoms. So teaching them, breathing skills is really helpful. Tips like, or skills like tip, the five senses, I think is also really helpful. And I do believe that we have some materials on how to engage in these kinds of strategies. So it'll be a breakdown of different steps. But these are essentially skills that you can teach very quickly, and they're very effective because you can do it on your own and in private as well.
Yeah. Um, the next question is, how can I help my autistic son learn how to better express his feelings more and be able to explain why? And that is something that is going to be a process because one of the main markers of autism is that challenge, and difference in being able to express emotions. So I think each person is different, and this is something that you can work with a counselor or with any type of a mental health professional with. But a lot of times it's first making them feel safe and comfortable to express what they're feeling, letting them know that they will be supported and that, if children feel like you're going to have a negative reaction to their emotion or to their experience, they learn naturally to withdraw those things because it doesn't feel safe. So the first thing is just making sure that there is a safe environment for them to express themselves. And then, like we talked about with the modeling earlier, it might look like just talking about emotions for a while so that they know what they are. So maybe not even getting specifically to his emotion at first, but starting in general with this is what sadness looks like. This is what would cause sadness, and this is what we do when we're sad. Or walking through all of the emotions, because then he might think internally or recognize those things within himself, and it might be easier to then communicate, like, oh, I feel like that boy in the picture, or that happened to me before. Maybe what I'm feeling right now is anxiety, or what I'm feeling right now is anger. And so the modeling and the education portion of emotions and emotional expression is really important. And then explaining why, that really goes into like the verbal capacity of your child, which is different for all children and for all children with neurodevelopmental disorders. And so it's important to be flexible and also know that one child's expression is not going to necessarily match the expression of another child. But practice can help everyone, no matter where they are. So sometimes it's helpful to give sentence stems. So that's kind of like when you have the fill in the blank of, I feel blank because blank, or I did this because blank, and they can fill it in. Maybe it looks like having some choices for them, like, do you feel this way or do you feel that way? And that can help kind of simplify the communication process. But as I said before, there are so many different techniques and interventions depending on the specific needs of your child. And so that's something that there's lots of resources for and that you can work with a counselor for with as well. The next question says, what to do when your teenager with mental health problems, anxiety, does not want to access therapy services? Um, and that is tricky. It's tricky with adults and teenagers alike, because therapy is not as successful when it's something that is forced or it's not voluntary. And so I think each person, again, is different, which is kind of the answer to all of these questions. But maybe a suggestion could be showing them and teaching them the benefits that accessing mental health care can have for them, and then working with them to see what modality they feel most comfortable with. Because not every therapist feels the same. Maybe they would like a younger therapist that seems a little bit more like a peer. Maybe they want to join a group counseling where they get to be with other people their age who are going through the same things as them. It can look like maybe we are not doing therapy, but we'll just attend some workshops, kind of like the one that we're in now together, and explaining what the benefit of all of those things can have so that they can get more on board and you work with what they want within like the time frame that they want, the person, what it looks like. It's nice that we are having more mental health care services in the world now. So there are some, like a variety of services that you can access, and that might help find something that they're willing to try. Um, The next one says, what are the body signals of anxiety or depression in a child with autism that he does not know how to express verbally? Um, Again, all of them are different, but it might look like making different like sounds or expressing something verbally, even if it's not something that to you appears to be an emotion. It can look like different body movements that are repetitive, that are usually the body trying to calm itself down or coping with the amount of stimulation that it has. Um, and then traditional symptoms of anxiety and depression also apply here as well. So some of those things on that slide we saw before, like mood swings or changes in appetite, changes in sleep patterns, um, some other things, like if they're just uncontrollably crying, or if it's really hard to calm them down when they're doing a transition from one moment to the next. Like usually bedtime is an easier process, but right now it's becoming super challenging for everyone. Things like that are signs that maybe they're going through a challenging moment and they need some more support. Oh, and I also really love what Nicole just added in the chat. I don't know if you wanted to speak a little bit more to that for the previous question.
Yeah, definitely. I think when considering why a teenager or an adult may not want to receive services, I think it's really important to kind of approach the situation with kind of a calm presence and really normalize the experience of receiving therapy. I think what Yasmin mentioned with like modeling and the few different things she said, those are also really important. And normalizing the experience could support them in receiving those services, as well as kind of exploring on a deeper level why they may be hesitant at first to receive those services and kind of coming from a really safe space so that they can explore why they might be kind of hesitant for that.
All righty. Well, I don't see any more questions in the chat or the Q&A. So with that, I want to say thank you so much for joining us today. We hope that you enjoyed today's presentation on identifying mental health needs in youths. A special thanks to our presenters for leading this webinar on such a great and important topic. Um, if lastly, if anyone has any additional questions that you would like for us to share with our presenter or with our agency, please feel free to follow up via email or during our intake line, which is also on the chat. So thank you again for joining us, and we hope that you have a wonderful rest of your day. Thank you, Nicole. Thank you, Jasmine and Martin. All righty.
You take care. Have a good day.
Thank you for having us and have a great weekend.
Bye-bye.